Welcome back to Yahoo Finance Live. I'm senior healthcare reporter Angela Khemlani. As part of Healthcare Week here at Yahoo Finance, we're taking a closer look at the latest blockbuster trend to rock the medical world: anti-obesity drugs. Names like Wegovy and Zepbound have gripped headlines and fueled massive profits for drug makers. And the drugs may do more than just help patients lose weight. A recent study from the New England Journal of Medicine found Wegovy cut the risk of serious heart problems for patients without diabetes. But what do these drugs mean for patients and the future of weight management? Joining me is Dr. Angela Fitch, president of the Obesity Medicine Association. Dr. Fitch, pleasure to have you on. Obviously, some exciting news in this space. For years and years, I know you and I have talked before about how finally the stigma of obesity is lifting. But how does this news of Wegovy's impacts sort of help the industry with broader than just anti-obesity implications?
Where we finally have been able to show what we've known all along, which is that treating obesity is not about weight loss, it's about gaining health, right? It's about gaining health, not losing weight. And again, we finally have been able to show that. We've known that for quite some time, but insurance companies, one of the big issues we have in our country is that obesity treatment as a disease is not a standard benefit on health plans. So hopefully this will change that and make obesity a standard benefit on all health plans for all Americans.
Yeah, definitely. That's part of the implications, looking at broader coverage. But I know there's other studies happening right now with Wegovy, in fact. And then obviously the implications for Zepbound sort of filter through this. There's other diseases that are being looked at. For years, we've known that GLP-1s do have some implications for other diseases. Are we starting to see maybe more studies coming in that help support that?
Yes, we have this study that was just published recently on cardiovascular disease as far as heart failure, which looked at Wegovy in patients with heart failure, which showed a significant benefit in that category. We know the kidney study was just stopped early because of so many good benefits. They couldn't ethically continue the study because they couldn't continue to give patients placebo, knowing that there were such profound benefits in kidney function and prevention of worsening of kidney function and kidney failure and dialysis. So we're going to see all of these, great benefits from the treatment of obesity, and we hope that that will, also be part of what is seen with our new medications as well coming forward.
Yeah, these new medications really interesting for multiple reasons. Obviously, a new trend and better weight loss results. I wonder about how this plays out, though, when it comes to, to your point initially for coverage, but also for patients in the long term. There's definitely been debate about how long patients are willing to stay on some of these drugs, knowing the side effects. As of right now, what do you think will be sort of this, long-term impact if there are people maybe dropping off the drugs after a year?
Yeah, well, I think, some of the data we have right now showing that patients do drop off medication is not necessarily related to them not tolerating the drug. It's because we have a huge access and a supply issue. And so again, the recent data is a little bit misleading because we haven't been able to keep patients on medication. We've had a lot of telemedicine companies and other companies that have come forward taking advantage in this space of getting patients access to medications. But it's more than getting a patient an access to a drug. It's about getting a patient to a doctor who can take care of them. And that's a different story than just someone, texting and getting a drug, by a text. So again, I think, the more we treat obesity as a chronic disease, we're going to see more and more patients being able to tolerate these medications and stay on treatment, just like in the clinical trials where less than 15% of people, or 16% of people stopped treatment because they couldn't tolerate it.
And we know, of course, the pills are on the horizon in that pipeline. What about the improvements to things like diet and that whole care solution that I know you've talked about before? We seem to not have as much on hand, at least in the headlines, if you will, but definitely something that needs to be paid attention to, especially in light of the fact that there is a shortage of these drugs right now. So there seems to be both demand for the drugs, at least to try them out, not enough supply, and then simultaneously not enough attention on other areas where healthcare can help with weight loss.
Yeah, obesity is a chronic disease and we need to treat it that way. We at the Obesity Medicine Association have our pillars of obesity treatment, which includes focusing on nutrition therapy, physical activity, behavior change, things like stress management and sleep are very important to overall health and weight management. And then also our medications and surgeries. So again, it's important to deliver the whole comprehensive spectrum of care over the course of a patient's lifetime. This is a lifetime disease. At my new clinic called Known we treat patients from teenage years all the way to adulthood and into their late adulthood. And so again, treating this as a chronic disease is what's going to be so important moving forward because it is something that patients are going to struggle with. It's not a quick fix. There's nothing to be a quick fix about it.
And really quickly, before I let you go, how would you differentiate, what's different this time around with this conversation and these drugs?
Well, I think what's really different is, again, that we finally, as you mentioned when you first came on, that we finally have started to decrease the stigma of the disease of obesity. The disease of obesity has very much been felt by patients and by society that it's just their fault, that if they could just somehow live differently within the society that's been put before them, if they could somehow manage that, they would not have this disease. And we know that that's not true. And I think now more and more we're seeing the benefits of these medications. The SELECT trial, there was a benefit even before weight loss happened. Mm-hmm. So that shows that there's a benefit of the medication by itself, not just the weight loss.
Absolutely. Well, we'll have to leave it there. Thank you so much, Dr. Angela Fitch, President of the Obesity Medicine Association.
Thank you for having me.